Welcome to a new episode of Médecine in 3 minutes. You go straight to the point, the subjective bravely made clear and often illustrate. Let's start. Today's topic is about Dandy-Walker syndrome. During this presentation, we will deal with the definition, anatomical remainder of the cerebellum, physiopathology, epidemiology, symptom, genetic condition, the diagnosis, and treatment. Dandy-Walker malformation or Dandy-Walker syndrome is a rare congenital malformation in which the part joining the two hemispheres, the cerebellum vermis, does not fully form, and the fourth ventricle and space behind the cerebellum, the posterior fossa, are enlarged with cerebrospinal fluid. Here's the cerebellum, both hemispheres, the floccular nodular lobe, the paravermis, and here's the vermis in blue, which is missing during this malformation. As we say, Dandy-Walker is a congenital malformation, cerebellar formation which control muscle coordination. The adjacent third and fourth ventricle are often affected, which can alter the flow of cerebral fluid, increasing intracranial pressure. The degree of disability is typically lifelong. There is a partial or complete failure to develop cerebellar vermis, which block the CSF circulation. The fourth ventricle is enlarged with compression of the brainstem, and there is a cyst in the cerebellum which the vermis is missing. Another way to illustrate malformation develops 5 and 6 weeks after conception. The posterior fossa is enlarged and the tentorium is high in pollution. This is the tentorium and it is high in pollution with agenesis of cerebellar vermis. Cystic dilation of the fourth ventricle, complication by hydrocephaly associated with spina bifida. From the epidemiology point of view, the prevalence of the syndrome is estimated at between 1 in 25,000 to 1 in 55,000. The syndrome is the cause of around 4.3% of cases in congenital hydrocephalus and 2.5% of all cases of hydrocephaly. At least 21% of those with the syndrome have a sibling with the malformation. Symptoms include increased head size, downward deviation of the eyes, vomiting, excessive sleepiness, and seizure. Genetic conditions are occipital omphalocele, agenesis of the corpus callosum, intellectual disability, congenital hair defect, and underdeveloped genital and kidney. Ciliopathic or genetic chromosal condition is identified in around half of those diagnosed before birth, a third of those diagnosed after birth. The condition is diagnosed by MRI in ultrasound in prenatal. Treatment for most involve the implantation of a cerebellar shunt in infancy. This is usually inserted in the posterior fossa. Shunt in the lateral ventricle used is in conjunction, and endoscopic third ventriculostomy is less invasive. Treatment may involve chirurgical placement of cerebellar shunt and physiotherapy. Dandy Walker think of malformation that develop in 5 and 6 weeks after conception. The posterior fossa is enlarged and the tentorium is high in position. There is agenesis of cerebellar vermis, cystic dilation of fourth ventricle, complication by hydrocephaly associated with spina bifida. Symptoms include increased head size, downward deviation of the eye, vomiting, excessive sleepiness, and seizure. Genetic conditions include occipital omphalocele, agenesis of the corpus callosum, intellectual disability, congenital hair defect, and underdeveloped genital and kidney. Treatment may involve surgical placement of cerebellar shunt with physiotherapy. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the like button and subscribe? Your comments are very welcome. Thank you.